schizophrenia, it is the chronic disease, right? Chronic mental disorder. And also patient require the lifelong treatment. I said schizophrenia patient, the disease is a chronic, and also patient need lifelong treatment, right? And schizophrenia cannot tell, the patient cannot tell difference between real and unreal. It is difficult for them to distinguish reality and unreal. And some of the schizophrenia patient has a positive psychotic symptom. Some of them has a negative psychotic symptom, right? So first of all, the patient who are diagnosed by schizophrenia, they have a character by psychotic feature. So I said some of the patient has a positive psychotic feature, some of negative psychotic feature. Also disorder of thinking process, or they have a disrupted interpersonal relationship, right? They have a abnormal or disturbance in affect, mood, behaves, and also thinking process. So treatment with medication control the symptoms. So as per I said, the schizophrenia patient have to take the medication lifelong. They need lifelong treatment. So when we collect the data from the patient during the history taking, what we have to see, patient has a tendency to neglect themselves or neglect of hygiene maintained. They have a neglect to eating, sleeping problem, or elimination problem, right? And also body image distortion, another problem. Or maybe they have a preoccupied with somatic complaint, very late stage, right? The somatic complaint. So most common sign and symptom of schizophrenia patient, one of them are the patient has a catatonic posture. So catatonic posture means abnormal holding, the bizarre posturing with the long period. So here I said the patient abnormal bizarre movement of their extremity for a long time, right? So for an abnormal bizarre movement or posturing of the patient for a long time, so catatonic posture. And also patients sometimes immobilization, total immobilized. They sitting in same position for a long time without any movement, or inability to respond to comments, or responding only to the comments. So sometimes they do not respond, or they respond in one direction. It is difficult for them to do the multitasks. And also they have a stereotypic movement. Stereotypic movement means they repeatedly do something, right? Like nail biting, or picking their hair, or compulsively picking skin, or banging their hand. So same movement they repeatedly do that, right? But the movement is aimless. The movement is aimless, and repeatedly they do. stereotypic movement. And also sometimes they have increased the agitation or inability to sleep or loss of appetite. And also schizophrenia patient is emotionally disturbed, they're disbalanced emotionally. So sometimes some of the patient has a difficult to get trust, mistrust may be present, or they have a feel unsafe their environment or threatened to something to them, right? So also sometimes they can feel helplessness or guilty or anxiety, right? And also here I said the schizophrenia patient, when we take the history, we can found some of them has a false belief. If the patient has a false belief in mind, this is delusion. So delusion is a positive psychotic symptom of schizophrenia patient. And sometimes some of the patient has a false belief with sensory component, like they can hearing something, they can feel somebody can touch them, they have some extra smelling sensation or feeling. This is called hallucination. So hallucination is false belief with sensory component. This is also the example of positive psychotic symptom. So the patient sometimes has a fragmentation of thought, or thought blocking, right? When you deal with the patient, some of the patient can use one or two absolutely new word. They making the new word, and making new word is meaningless. This is called neologism. So neologism means making new word that is meaningless. And some of the patient has a problem, they say repeatedly same things over and over again. And this is called echolalia. And some of the patient, if you deal with them, you can think they have a magical thinking. That thinking, there are no relationship with the reality. Or some of the patient has a fight of idea, means jumping one topic to other topic, jumping of ideas, I said. So what are the other synonym symptom of schizophrenia patient? So we said the abnormal thought process, right? Inability to conceptuation or inability to organize their logical fact. And delusion means false belief in their mind. So there's some type of delusion, right? One is called the delusion of persecution. So the patient thinking, always the thinking somebody are trying to kill them, somebody try to harm for them. So because of this thinking, they always withdraw themselves from the society, and they like to hidden themselves in their house, no communication in the outer world, because of the delusion of persecution. Or some of the patient has a delusion of grandiosity, because some patient can talk to the some invisible power like God. So that times they thought, oh, God talk to me. I am the superior. I am after God. I have a ability to talk to God. So this thinking give them grandiosity to the others. And also they have a somatic delusion in which the client believe that his or her body is changing, right? So it is somatic delusion. So I said delusion is a false belief in the mind. So what are the other problem? One is called illusion, that may be brief experience with misinterpreted or hallucination. So illusion means, we said, the illusion is a distortion of sense which can reveal how the human brain normally organized. So some of the schizophrenia patient has a illusion, and definitely some of the patient has a false belief with sensory component, which is called hallucination. So there are some category of hallucination. One is called hearing. So patient can hear something abnormal, hearing, or they can touch some abnormal sensation, or they can get a smell that other people are not getting, right? So here, or inability to organized language, and I said they have a neologism, also echolalia, they have a problem, and also they developed a private language. So if a patient in the family, or there are two patients in the family, they can talk each other, nobody can understand this. So they have some special meaning, only they can understand, not other. Or sometimes patient talk to them and they use the new word that is meaningful only to them, but other person who are healthy not understanding this. So what, as a nurse, when we work, what we have to, when we deal with the patient, what should our interaction or intervention? So we have to monitor the patient for any kind of positive psychotic symptom like schizophrenia, hallucination. So if patient has a hallucination, we have to try to find out the clue. All right. So if somebody has a hearing hallucination, maybe he or she get the direction to harmful themselves or harm to others. So if we find the clue, then it is held to protect them, also protect other person or other patient or ourselves as well. So always we interact with one to one. So it is better when we interact with one to one, or decrease the environmental stimuli. So quiet environment is good for them, and also avoid the conveying to the client that others are also experiencing hallucination. So we have to avoid this one. And also we do not touch the client because they are very sensitive. I said they are always thinking somebody is harmful to them, somebody is threatened to them. So if you touch them, who knows, they are thinking you are going to kill them. Always encourage the client to express their emotion, their feelings. But also keep in mind, if we see or if we find out the patient has any kind of suicidal ideation, then we make sure somebody is there. So also keep in mind the schizophrenia patient has some negative psychotic sign. So negative psychotic sign means sometimes they do not talk at all. This is called mute. Or sometimes they are catatonic. Catatonic, I saw you picture. And also some patient has a homicidal, right? Some are try to harm to others, or they have a suicidal ideation, or they withdraw themselves from the society, right? So I said the catatonic behavior. Catatonic behavior means inability to move normal their movement, right? So, or they have a stupor or motor rigidity. So, what are the other interaction when we do to interact with the patient? So, always we provide them easy activities or structural environment, routine function. So, also monitor for sign of increase any kind of anxiety, hesitation. We reduce the stimuli or administration the antipsychotic drugs. And also if the patient has a hallucination, always safety is the first priority. So what are the other interaction? The interact based on reality. Also we encouraging the patient to verbalize their feelings, right? And we do not disrupt the client or try to convince the client that delusion are false. So I said the patient has a delusion or hallucination. Both are false belief. So if you do not try to tell them it is absolutely false, you deal like, okay, let me think, let me see, right? So you do not say no, it is wrong. So it is actually when you deal with them, they uh, argue with you. So initially or initiate activation is one-to-one basis, or alter the hospital routine as needed, and also recognized accomplishment or provide positive feedback if they do any kind of success. So we have to do this. So basically this is we have to know for